All right, we're talking with the ladies from Coastal Kids Dental. What kinds of things do we forget about when we're taking care of our kids' teeth?
Majority of them are lacking is they don't think about the drinks that they drink and the foods that they eat, how it affects their teeth.
Yeah.
And majority of it is the drinking. Flossing is very important. Majority of them do not floss. And brushing before bedtime.
Right.
They think about that brushing with them in the morning, but not at night. And also for the importance of parents still, even Bailey's son's age, you can still get in there and brush his teeth because they're not doing it correctly.
Right.
And we need to teach them how to do it correctly and how long.
Yeah.
And that flossing is really important because you would see how many cavities we got that's in between.
Yeah.
And those are
because
the
they're not
hardest ones
flossing.
for you guys to deal with, aren't they?
The baby teeth especially are really small, so when the in-between cavities are bigger, it makes it harder to do a good filling that will stay in. And a lot of those in-betweens, like Melissa said, are caused by the drinks, which people don't think about.
Yeah.
Juice.
How much sugar is in those things? Wow.
Well, and it's sugar and acid, so even the sugar-free stuff. And so what people need to remember, it's frequency that causes cavities and not amount. So it's better to actually have a couple of cups at a time versus 1 cup all day long. So that's what the sippy cups are so bad because they carry them around, and so it's the frequency of
And with not brushing at night, it stays on their teeth.
Yeah, it stays on their teeth. So really try to keep things in moderation, and at meal times is when you should drink those juices and things like that, and then try to avoid a lot of snacking in between because again that just keeps the acid on your teeth and the low pH. So those are the important things to remember that people don't think about.
Wonderful. Thank you, ladies, so much for coming in. If you want to find out more about Dr. Isabel, go to